Okay, good afternoon and welcome to the March edition of the Staff Wellness and Health Booster Sessions. Our topic this month is more changes to stability. Where are we on the COVID-19 journey with Cynthia Carr. My name is Chad Saxon. I'm the Communications Coordinator for the Addictions Foundation in Manitoba, and I'll be your moderator for this session. So we'll get to Cynthia in a few seconds, but we have a few housekeeping items we want to look at before we do that. So as we all know, COVID-19 has challenged our health system workers to change how we conduct ourselves in the workplace, our homes, and our social connections. These changes can sometimes feel overwhelming. To support health system workers and the public, Shared Health and our Psychological Health and Safety Committee partners have brought together skilled trainers from across the province to facilitate several staff booster sessions. As noted, our presentation today will touch on where things stand with this pandemic. This has been a challenging time for us all, and it was almost 2 years ago on March 23rd, 2020, when Prime Minister Justin Trudeau told Canadians to go home and stay home. We thought we'd make some major and previously unimaginable sacrifices for a short period of time to flatten the curve. None of us could have imagined what would happen in the following 2 years with peaks and valleys of cases, medical breakthroughs and disappointments, community cohesiveness, and divides. In this session, we'll chat about some of the peaks and valleys as well as the impact on our health system and our society along the way. What decisions have aged well and what decisions have we learned from? What are the immediate areas of concern in our population and our healthcare system, and how will we move forward together? As I noted, our presenter today is Cynthia Carr. Cynthia has more than 28 years experience as an epidemiologist, community engagement facilitator, health policy specialist, program evaluator and indicator development, business case development expert, and strategic planner. After working for the Northwest Territories and Manitoba governments, she started EPI Research, which has now been in business for 21 years. Following the completion of Cynthia's presentation, we'll have a few minutes for questions. Also, today's session is being recorded and will be made available as a streaming video on demand on Shared Health's COVID-19 Mental Health Resources page. And with that, it's my pleasure to turn things over to Cynthia for her presentation.
Hi, everyone, and thanks for joining me today. There. Sorry, we just pilot tested this, and there we go. So this is a really tough time. We're really gotten used to saying this is a tough time, but you know, it's really hard right now. You know, and one of the things that we need to talk about is the World Health Organization has always identified conflict and war as one of the most important threats to successful pandemic management. We certainly saw that in the influenza pandemic of 1918, and there have been conflicts along the way we don't want to discount, obviously, but obviously the current crisis we're focusing on globally is with respect to Russia and the Ukraine. And, you know, that's really tough because, you know, there's increased mobility, there's challenges with upkeep of hygiene, reduced access to care, diversion of resources. And, you know, we're just in a clear and obvious crisis in that area of the world right now. And you know, that will impact potentially, you know, how we do with this pandemic moving forward. You know, when we look at what a pandemic phase looks like, we might think, you know, kind of what we learned about in school, it looks pretty cut and dry. We're at the gray areas, the interpandemic phase, not much going on, but we're supposed to be investing in surveillance, and then we start seeing something, we become alert, we hit this pandemic phase, and then it kind of cools off. We implement apparently what we've learned, we transition back to normal life. Well, we know, you know, since Prime Minister Trudeau told us to go home and stay home almost 2 years ago, our experience certainly hasn't gone that way. There have been many waves and many challenges and changes along the way, from that first kind of case in the end of December of 2019 to our first case here being identified March 12th. And then, of course, the new variants that came into play. And at this point, we're at almost 450 cases worldwide, over 6 million deaths. On the good news side, at least 2 out of 3 people in the world have had at least one dose of the vaccine. Almost 11 billion doses have been administered, but certainly, although over 80% of Canadians are fully vaccinated, we know that we've got differences within our country, within our provinces, which will continue to challenge our success. And certainly we need to continue to think from a global perspective. Less than 14% of people in our poorest countries have been vaccinated. And I just happened to look to see what the situation was in the Ukraine. About 1 in 3 people in the Ukraine were fully vaccinated. You know, all of these terms that we've heard since the last 2 years, we're all really sick of. We want to understand, you know, what worked, what didn't, the constant changes to rules, to mandates, to what we're learning in science. And obviously that's impacted our mental health, our ability to cope. Most of us aren't used to changing public health orders and understanding why those are used, and that can make people feel very uncomfortable. So we've had almost 60 public health orders during this pandemic so far, and obviously we were seeing, you know, all kinds of change along the way with restrictions that were sometimes really complicated, sometimes told us what we could buy in the store, sometimes told us, you know, how many people we can get together with, and then was parsed by vaccinated, not vaccinated, indoors, outdoors, just highly complicated. And now we're at a stage where, you know, the latest mandates were March 1st, proof of vaccination ending, and March 15th upcoming, the mandate requiring masks in public ending. And there's really a lot of differences in how we feel right now. Some people are feeling really good. Some people are feeling really anxious and uncertain. And of course, we have to be ready for the fact that these things can change again. So communicable disease and public health, as I said, it's really not our norm to have these conversations in Canada. Public health is not really highly on the radar. It's not sexy. It's sort of investment in many things that are long-term investments that aren't involving ribbon cuttings and things that we can see right away. So, you know, we saw where there were challenges in recognizing and reacting to the problem. Those are key for successful pandemic management, and different countries did things differently. How did you communicate what the problem was and what you needed people to do? How did you get people to buy into those solutions, particularly when it was an evolving situation, which is what science does. Science isn't just a black-white answer one day. You continue to learn, continue to research. That's actually good, but what happened is obviously it created distrust and uneasiness among many people. And add to that the social media war, which is very difficult for people. When you're on social media, it's often hard to know, is this a trusted source or a not trusted source? Because it's easy to make a message look official. As I said, you know, we're not really used to talking about public health, communicable disease, having that on the radar. This graphic here is just from the World Health Organization, and I just wanted you to kind of focus over on the age group graph, and you can see that for the most part, we're focusing not on communicable disease, which is the blue. That's mostly our little ones where we're worried about communicable disease, whether it's influenza in little ones or meningitis, for example. But for the most part, we're focusing on the red, the non-communicable disease, heart disease, cancers, those kinds of things. So, you know, when we look at just our own backyard, we can really miss the real threats. So again, at the top graph here, and let's not get too into the numbers, just focus on the blue and red. Again, we're really focused on kind of rich people problems, people who live a long time with support for the most part. We're looking at cancer, cardiovascular disease. When we look at around the world, the global burden of disease, we see more of the red kind of creeping up in terms of neonatal disorders, respiratory infections. And again, we could say, yeah, but for the most part, I don't know, infectious disease aren't that important. But again, if we look at inequity, if we look at disparity, we know that we're a highly interconnected world. And when we leave a huge portion of the world population in a very different circumstance from us, we are absolutely impacted. So when we look at the share of burden of illness by cause, the red really moves up when we look at our poorest countries. We're looking at babies dying. We're looking at respiratory infections, the second leading burden of disease causing death and illness, malaria, etc. It's a little ways down before you get to some of our serious concerns like cardiovascular disease and cancer. So again, I hope that's been a learning along the way, that we need to focus on equity and support to prevent outbreaks of infectious disease, to provide support in real time to prevent continuing spread when these infectious diseases happen. Of course, Omicron has really thrown a wrench into things, but in some ways, kind of in a good way. It's really interesting to think about it, but scientists are reminding us that right now with Omicron, this is quite possibly the point in time where the most people in the world have been infected with the same virus at the same period of time since the 1918 flu pandemic. So what that's done is we've seen those massive increases in trajectory of cases, but because we also had vaccination going on, and again, many of the more fortunate countries had high vaccination rates, what we've seen is this mix of vaccination, natural infection that actually will help us as we move forward. We never want to encourage natural infection as the first course because even Omicron can be serious, but at this stage, it really has been a game changer with the speed of spread around the world and that combination of populations that did have protections in place, but we're certainly not at a predictable stage, but we are at a stage where we would say this is not really a new virus anymore, so we need to kind of transition to continued vigilance, but not anxiety. These graphs again are just showing you the sequencing of the virus and how quickly things changed. So, at the beginning here we are actually exactly a year ago, March 8th. You can see the various colors by different countries of what the variants of the virus were at that time. And then very quickly, here we are on the bottom right-hand corner, it's basically all Omicron in many areas of the world. Here we are in this bottom left corner, this is just 3 months ago, where we can see that Delta in the blue and Omicron in the red, and up here in the top right corner was very much Delta just a month or two before Omicron was really starting to spread. So again, these past 3 months have been a huge game changer around the world with respect to Omicron really being absolutely the dominant strain. The impact on this again has been as we've gone through the waves of these diseases, of the variants, we've seen increases and decreases. The blue down here is actually our case rate, and the orange is our percentage of hospitalizations along the way. And again, what we've seen is that in this past 3 months, so from December to March, just 3 months, our numbers of reported cases, and we know there's been significant decline in testing, our numbers of reported cases have almost doubled just in this 3-month period compared to almost 2 years of living with the pandemic. Today, our active case rate that we know about is about 5 times what it was 3 months ago. There's only been a 20% increase in numbers of tests, even though, as I said, our known case rates have doubled. So certainly, even with the decline in testing, there's a much higher circulation that we're still dealing with. Our hospitalization rates have increased, as have our deaths, of course, in the last 3 months, but not at all proportional to the number of cases, which is a good thing, which is part of the reason for feeling like we can kind of start to move into a transition, even though the pandemic certainly is not over. We are in a very different place than we were 2 years ago. Those changes have been both positive and, of course, negative that have impacted us as a society. Obviously, some of our peaks have been the speed at which vaccination became available through clinical trials that built on previous research that had been invested in, particularly with the coronavirus since SARS in the early 2000s. Companies were able to build on that research with absolute speed and urgency with resources in terms of funding provided. And again, part of the reason for the speed was not cutting corners on safety. It was government saying to companies, start developing your supply chain, your capacity now. We'll pay for it even if we can't use those vaccines. So we've seen, some really exciting evolutions in science with speed of safe vaccine with distribution, but again, that hasn't happened globally, and we know there's a long way to go globally. Some other really exciting news is in the treatment side. So in the beginning with hospital care, trying to understand where did COVID impact the body, how did you treat people, talking a lot about people requiring mechanical ventilation, to now sort of looking at out of hospital care and what are some antiviral drugs that really do seem to be working and that can be provided again in an out of hospital setting, which will have enormous impact on our ability to feel comfortable in returning to normal life and ease up the burden in the health system. Obviously, misinformation, disinformation, and malinformation have been hugely problematic during this pandemic, partly through, our bumbling in terms of public health and government, and doing our best, but making mistakes about how do we communicate this, saying things as an absolute when things were still evolving, because there were times we got excited and we thought we had the answer, or we were reflecting on previous information and applying it to a current situation. I think all of us wish, of course, that we understood from the beginning the extent of asymptomatic spread. I think that really would have changed much of the messaging from the start and changed much of our messaging, of course, around masks, because that was very confusing when people were told, why they shouldn't wear masks when we were focusing on social distancing and other sort of public health policies, because we were still focusing on the fact that only the mask wearer typically, only the person who's carrying the virus and is, quote, sick would typically wear a mask. And again, we didn't understand at that time how many asymptomatic carriers there were, and so that we all had to act as though we were carrying the virus. That was very, very confusing for people. Now we're in a situation, obviously, where we had our first mask mandates that were implemented, lots of confusion about that. They were lifted very briefly in last summer, but that didn't last long. It lasted 17 days. There was a lot of pressure to kind of follow what the Western provinces were doing. Remember, Alberta, July 1st of last summer, we're open for summer. Basically, things are over, and we saw very quickly an escalation of cases after that. So now, of course, we're looking at what will happen when the mask mandates are lifted again. How long will it last? And hopefully it will last. But it'll be interesting to see how people transition and what businesses do, because not every business is ready to remove that mask mandate in their setting. And again, that's going to rely on real communication. This is just a real quick kind of visual of just the conflicting and massive numbers of headlines around masks and that kind of confuse people. But we really do have to understand that cases and serious outcomes are dropping around the world. We're monitoring that, and certainly, mandates aren't meant to be forever. Again, those of us who work in public health, we know that there's communicable disease orders that can be implemented at any time, but it's very rare in Canada. It's often, if used perhaps around tuberculosis, those kinds of things, when there's a risk to somebody who's not complying. But masks do need to come to an end. But because the cases still seem quite high right now compared to where we've been, even though they're dropping, it is confusing for people, and they're wondering, is it really science? Is it political pressure? Is it a bit of both? So with that, we kind of have to think about moving forward and remember that even without mandates, we can still make good decisions. Keep taking our own precautions, wearing a mask, social distancing, those are all kind of back on us, and thinking about how to mitigate the risks as we go forward. You know, we know that masks, vaccines, really understanding our environment, whether we're traveling to another country, understand the rate of community spread, understand the hospital system. Are they overwhelmed right now with COVID or other health issues? Is that a safe place to go even if you don't get COVID, if you need to use hospital resources? It's kind of, sometimes people are uncomfortable when we talk about make changes to your health if you can, because people feel like they're being blamed for being sick. But epidemiology really is looking at disease patterns by person, by place, and by time. And we really have learned a lot about the risks related to an infectious disease if we already have other chronic disease or other kind of less optimal health or living conditions that we are in. So, you know, we want to continue to really think about wearing a mask. They really are easy to wear. And the good news is there's much more availability of high quality masks, such as KN95, the international kind of mask that's available, obviously N95 in the healthcare system. And research continues to support the use of masks in preventing spread, even with Omicron, but again, particularly with respect to the KN95 and N95 higher quality masks. We really are at a risk with people kind of dropping off in terms of that booster shot, but we really need to continue to focus on preventing that threat of dropping interest in vaccine and sort of confusion that people have about prevention of illness versus prevention of serious outcomes. And we need to continue getting better at that messaging and fight against some of that negative social media messaging, which has just kind of intensified anger and confusion and changed sort of the perception of threat of the illness to perception of threat to our own freedom of choice, etc. So we want to continue with that messaging, and obviously with the fundamentals that I know, again, we're sick of hearing about. But we really do need to focus on, okay, we're going to continue with these fundamentals at a personal level. We really need to continue to understand the investment by our employers in supporting their employees when they are saying that they're home, they need to stay home because they're sick, and having that trust that it's going to be okay to continue to do so. So that trust has to go both ways between staff and employers. So the reality of 2022, you know, we're impacted by many people having experienced increases in anxiety and depression during the pandemic that is not just going to magically go away. For people who have also had serious illness, 1 in 3 people several months after being released from hospital in research have been shown to still be showing some kind of a neurological or psychological impact, whether it's fatigue, anxiety, depression continuing. A recent research of young people in the United States have shown an obvious increase in emergency department visits for mental health amongst youth, particularly among young women. So that's something that we need to continue to focus on and understand and provide support for. A positive, though, is that research has shown that people after receiving even 1 dose of their vaccine showed a significant decrease in depression and anxiety levels because they felt like they were doing something for themselves. But we need to continue to support that thinking and understanding with the linking of vaccine to prevention of severe health outcomes. We know that in the health system and in society, there are many impacts related to delayed care that we have to continue to focus on, develop resources, whether it's lack of timely access to screening, improper management of chronic conditions that were already known or that have not been diagnosed yet, delay in many surgeries, and again, the impact on our mental health, on development of habits that are not as healthy as we would have liked, because we weren't able to do many of those things that helped us, whether it's go to the gym, go to church, get together socially. So there's lots for us to continue to deal with, and data clearly supports that these things have increased and are occurring, and we need to continue to make sure that we highlight these needs and continue to expect government to invest. We can't just expect, this is a quote from myself in a recent interview, we can't just expect to get rid of the worries immediately that we've lived with during the pandemic. We need to kind of take our time, don't feel pressured. If you're not comfortable going somewhere, for example, that doesn't require vaccination, proof of vaccination, just don't go for the next little while. But that doesn't mean we have to kind of engage in arguments with each other and continue to escalate stress. Obviously, the million-dollar question to everybody in healthcare is, when will this be over? What is endemic? And really that is kind of when we can kind of reasonably predict and understand the patterns of this disease, kind of like in the flu. We know kind of when the season will be. Obviously, there can be variants that catch us off guard and we have more cases or less cases from year to year, but we have a pretty good understanding of the impact and the patterns. We're still really not there yet with COVID. Even just again, between Delta and Omicron, there have been massive changes. So, you know, we're still on our way there, and we need to also continue to remind people, endemic doesn't mean it's not serious. Again, just the common cold can be serious for some people, and influenza can certainly be serious, again, for our youngest population and our oldest. So we don't want that perception to be out there that we just have to get to endemic and it won't be a problem. Some really imperative investments that have been announced in the United States recently with commitments that I'd like to see here in Canada, with dollars assigned, timelines assigned, absolutely improvement in quality of our indoor air, surveillance and communication, and including continued investment in wastewater, increasing testing availability and capacity. You know, that rapid testing availability really has been transformational during COVID. We need to continue this. We need to follow in what the USA is announcing with test to treat. Literally go to your local drugstore, get a rapid test, get some free, get provided a free oral antiviral pill on the spot, or a package of pills. So of course that goes with, you know, you're lucky to be in a country with money. We have to look at supply chain and resources, but we need to be moving there. These ongoing learnings in antiviral treatment is so exciting in terms of, you know, oral pills that are actually attacking the virus, preventing it from dividing in our body and causing worse infections, which is allowing people to use oral medication out of hospital settings. We need to continue to expand testing for and capacity to treat and detect new variants. We can't just stick with, oh, we came up with a solution. We need to keep learning. We need to continue with enhancing vaccine uptake locally and globally, and don't take our eye off the ball here. Supporting people with long COVID, understanding the impact on kids, and continued understanding of infectious viruses and prevention, and getting kind of our ducks in a row for vaccine readiness, and keep fighting misinformation that really has undermined our vaccine confidence, and again, support, meaningful support and investment in workplace policies in support of staff. Some of these harder sells, looking at really the socioeconomic determinants of health, that loud and clear. We need to understand that not everybody was impacted equally, and we need to kind of look at in the long term how we can support people living with these inequities. But we also need to, again, continue to focus on public health and prevention of chronic disease, of lifestyle factors that got the best of us, such as obesity, because certainly people were more vulnerable the less healthy they were. But that didn't mean if you thought you were healthy, you shouldn't get vaccinated, obviously, but vulnerabilities are clear. So as we close, sort of some of the risks I'm worried about is losing focus, competing priorities, losing our momentum in our working together in global research and knowledge, not fully investing in what kids have been through and how we need to help them, obviously the impact of war, obviously the impact of long COVID, which will impact our workplace too if people aren't able to return to work because they're still experiencing long COVID impacts. Just quickly, some cool things that are going on. Lots of people wondering, as you know, Omi Delta or Delta Omicron a thing, you know, in the sense of are people able to get infected with two viruses or two variants at the same time? Can they actually merge together and become a new variant? Yes, recombination is possible. It is identified very, very, very small number of cases right now. And as I showed at the beginning of this presentation, really, although there was a little bit of this going on before Christmas, Omicron is very much taking over. We're still trying to understand, you know, hey, why didn't some people get COVID-19 even when they were in risky situations? Yeah, it's true. Our immune system does react differently, but research is just looking into like what are some of the reasons that people might not have gotten sick, and we just need to continue with some of that research that's really exciting right now, but understand that with emerging variants, we have to keep that messaging out there that even if you haven't gotten sick and even if you are vaccinated, you need to be cautious because variants again can change things on us. Cool research with, you know, what's the deal with COVID and the brain? Is it inflammation? Is it connections within the brain? Is it a long-term injury? Is that virus still lingering in our body and we just can't detect it? Is it the response of the immune system that was triggered? Because many, many people still talk about that brain fog and other really noticeable changes on their brain. There's a recently published piece of research from Nature magazine, very small study, but I just thought you might think this was cool, where they happened to look at people who they had brain scans from before becoming infected with COVID compared to those after COVID. And they are seeing that there actually are changes to the brain, particularly in that memory and area that's related to smell. And actually, when they also got people to do tested, when they looked at the differences between two groups had been infected and not infected, there were differences that are real in completing cognitive tests. So if you are feeling this way or others around you are feeling this way, just don't doubt yourself. Understand that, you know, the bad news, good news is that you are being scientifically validated, that unfortunately clearing the virus did not mean that everybody is just free of the impact, and certainly ongoing brain research is continuing. And I don't know if any of you saw 60 Minutes the other night, but really cool story out of the CDC, again, on the what they're doing right now, and even just in terms of vigilance around other viruses to understand those better and start developing, again, vaccine protocols and treatment within the lab setting as a start so that, you know, kind of we're ready moving forward as viruses change and evolve and don't just focus on coronavirus. So what's the new normal? Let's always be vigilant. We've got to be ready for change. Mandates may change. We may wear masks again. Changes in vaccine access. We really need to enhance that and improve that. And really just unfortunately live in a heightened state of awareness, understanding the importance of prevention of disease. That people really didn't talk about before, but try not to live in a state, you know, of anxiety, because that's just not going to help us. So I know that was a little bit lengthy, sorry about that, and I'll kind of end it there for any questions.
Great. Well, thank you very much for that presentation. That was very informative and lots of really interesting information, and kind of gives a good look into kind of where we're going and how we might approach things for the future. We did have one question come up during your presentation. The individual is wondering, how is the allocation of some of the new treatments being determined, since at that time there are limited resources of some of these treatments?
That's a really good point. When we focus on the good news of treatments being authorized, that doesn't mean they're accessible, and we need to be very clear on that. There are literally perhaps in the tens to hundreds thousand of availability of regimens of some of these antivirals that have been approved. And again, so some of that will be focused on providing to people who are healthier, are having mild illness, that will help those people stay out of the hospital. But certainly the concern is there about who's making these decisions, where will this become available, and how quickly. kind of really underscores again the need that we've learned for having supply chain development capacity in Canada as well.
Yeah, I think that's a very important point to start bringing a little bit more of this in country. Another question we had, speaking of misinformation on social media, we often would hear from sources that were less supportive of mask mandates and vaccines that scientists were divided on these issues. Can you speak a bit to that divide? Is the scientific community really split 50-50 on if vaccines and masks are a good idea, or is the divide smaller than that?
It's a really good point. Divide does not mean 50-50. Certainly, different organizations came to different conclusions at different points in time. There was differences in when communication occurred. And again, when you look at the World Health Organization kind of handbook to pandemic management, one of the biggest risks that they do identify, capital C, communication, both within the organization and externally, deciding who's going to do the speaking and when, because those conflicts really did make some of those conflicting messaging really did make it seem like it's a huge C conflict, where it was just sort of different science tables looking for different levels of information, taking different periods of time to get together and to communicate those decisions. So certainly the differences of opinion were not as large as social media would make it appear, but we did have challenges in timeline and in communicating.
Mm-hmm. Yeah, I think there was a lot of unfortunate sort of cherry picking of information to try and support people's case one way or another. And I think, like you said, like it doesn't mean it was 50-50, but I think people tried to maybe illuminate it as that. That's I don't see any other questions at the moment, but I'm kind of curious. Is there a concern among maybe yourself and your peers that if we have another large wave of COVID, or perhaps maybe we have another virus, cross our fingers that doesn't happen again, that given everything that's gone on and the fatigue maybe that's in the world right now, that there'll be much less buy-in on the next time around, and we may be in a worse situation than we currently are or have experienced?
I think again, it's going to depend on some of those key points from the beginning of the presentation. Recognize, react, and effective communication. What do we know? What don't we know? What do we need you to do? And we can build on, again, how much we've learned in the past 2 years as the good news story, and understand where we made mistakes. And we really will need to communicate that. Like, look, here's what we understand now. Here's what we need to do quickly, and here's why. If we don't, again, implement some of those lessons learned, we're going to be in trouble. But when we look at sort of the pattern of sort of hindsight, oversight, foresight, that 60% needs to be at foresight. We need to continue with planning about what we're going to do moving forward, where we need to invest, so that people continue to develop trust. We have better channels of communication and sort of quicker reaction when we need to react.
Right. Very good points. So we did have another question come in. Many schools are deciding that masks will not be mandatory next week, but some school divisions are not even encouraging optional use. How do you anticipate this will turn out?
Well, certainly we know that kids spread the virus. Fortunately, at this stage, it still remains a small percentage of kids that become very ill. We're still understanding how the spread from kids to adults goes, because obviously we need to think about teachers. What we really need to do moving forward, though, because their viruses will always be circulating, particularly, in highly mobile populations such as young people with ever developing, their immune systems are developing as they're growing up. We need to invest in indoor air quality in the school settings. That doesn't directly answer your question about how this is going to play out. My concern is about confusion amongst kids, amongst parents, potential for bullying. We certainly saw that, horrific situation in Florida where students were standing behind a political figure who turned around and berated them for their COVID theater in wearing masks. That was a horrific moment, humiliating for those kids involved, and certainly not good messaging. So I am concerned again about how the messaging is handled in the school system, as well as just what the impact will be of the virus, but that the support of choice and being comfortable, because again, we're highly anxious, and that includes kids.
Yeah, no question about it. And I think, yeah, you raise a good point about the potential for items, things such as bullying and other troubles like that to take place. And so hopefully that's something that's able to kind of work its way through. But I'm not seeing any other questions at the moment. But I just, I'm kind of curious, and you certainly, obviously, you did touch on this throughout your presentation. The phrase new normal, or even how learn to live with COVID, I think is probably almost become the replacement for new normal. What do you see as that, as learn to live with COVID, just for the average family?
So again, I know I spoke quickly because I had a lot of slides, but the new normal, I feel, should and probably will include, for most of us, that enhanced kind of vigilance, both at every level down to our individual level, being more aware of risk, thinking about options, about whether or not I want to be in a certain setting, whether it's during flu season, cold season, just sort of bringing those public health principles into our real life. So that should be our new normal. Our new normal should include an investment in surveillance, including some of that kind of more passive surveillance of I'll say wastewater. I'm saying passive because it doesn't include testing people, but we need to still have investment in sort of testing, random testing, however that's going to look. So again, we're on top of it, and we continue to invest in knowledge before, there's a knowledge before the crisis. So the new normal, enhanced vigilance, understanding that there might be changes. We're going to be kind of more used to mandates coming and going. That's something that most of us weren't used to. But the reality is the new normal includes many of us going to need help for our mental health, for our anxiety, our kids that might have suffered some setbacks in schooling and in other areas. So the new normal is not just rosy and everything's great again, but it can be a better future if we actually learn from and retain that memory and invest in solutions moving forward.
Mm-hmm. Here's hoping that's the case. We did have another question come in. Is there any advice you would give to those with compromised immune systems when they have to put themselves into higher risk situations? Examples obviously would be work, school, grocery shopping, things of that nature.
That's right. So, people who have are undergoing or undergone certain treatments, for example, for cancer, or have a disease that impacts their immune system, whether it's HIV, for example, have always had to have sort of a heightened vigilance in their decision making. So, unfortunately, that will continue. And my advice again would be, particularly during seasons where there's more circulating virus, again, whether it's influenza or COVID-19 is continuing to circulate, you would be strongly encouraged to continue, with wearing a mask. Maybe making decisions not to go to events where there's thousands and thousands of people just yet. And unfortunately, that sounds punishing, but that's just sort of a level of protection and precaution for your own health. But we can't offload this. We as a society, again, need to continue with our social contract with, if I'm feeling symptoms of illness, or I know I'm in contact with somebody with a new infection, I also shouldn't go out, so that people with compromised immune system or who are older, for example, aren't always bearing the burden of the risk. We need to really move forward in this social contract.
Absolutely. We had another question. Can you tell me what the difference is between KN95 and N95 masks?
I wish I had one with me. So the KN95, we'll just call it kind of an international standard. So the KN95 is an excellent mask, and it's a mask because it typically has the strap behind the ear. In order to be a respirator, the strap would go around your head as healthcare workers. I don't need to tell you that. The N95, the difference is it is approved for the occupational setting, meaning that in North America, for an occupational setting requiring a mask, it is only the N95 that you could wear in that, for example, health setting. So they're really less available to us. That's really the big difference, is the KN95, by virtue of not being approved in that occupational setting, makes it more available to us. But they're both very, very good, again, at preventing those particles. The N95, for those of you that have worn them, one of the slight differences is that airflow. It is a little more comfortable. If you're wearing it for 8 hours at a time, you obviously can feel as you're inhaling and exhaling, you're not sucking in the mask as much, but you still have a really good seal. So they're basically both excellent masks. It's just the KN95 will be more available for the community at large.
Mm-hmm. And the N95 also, that's the one that you need to be fit tested for, correct?
Correct. So the N95 you would be fit tested for in your occupational setting.
Right. Excellent. Well, thank you very much for that. I'm not seeing any additional questions, so I think what we'll do right now is maybe we'll just close things out here. So I just want to say again, thank you very much for your presentation today. It was very informative, and I think certainly know myself, and I hope everybody else has lots of takeaways and lots of great information that they can move forward with. And I just wanted to also mention the fact that this, if you're interested in watching the presentation again, we will be posting this to the Shared Health, Mental Health and Wellness page, and I believe it's you can access it through their COVID-19 resources page. So it'll be up in about a week's time, so you can go back and take a look there if there's anything you missed. And of course, we'll also be back. We'll have another session in April. We don't have one quite planned yet, but as always, we'll make sure to communicate that through the usual channels. So again, with that, I just want to say thank you to Cynthia and thank you everyone for attending, and have a good day.
Thank you.